Thank you, Chris, and thank you, members of the media, for joining us once again today. We appreciate you allowing us to get our message out, and we appreciate the support that you have given us during this entire pandemic. Once again, we are here at the Cross Insurance Center in Bangor, Maine. It's a little bit quieter today than we've seen in the past, because our second pod is closed down, and we'll talk a little bit about that when we get to the actual briefing. But before that, I'll give you some numbers. As of this morning, Northern Light Health is taking care of a total of 19 patients within our system who are positive for COVID-19. 3 of those are admitted to A.R. Gould Hospital, 1 at C.A. Dean Hospital, 8 at Eastern Maine Medical Center, 2 at Inland Hospital, 3 at Mercy Hospital, and 2 at Sebasticook Valley Hospital. We are also caring for 4 individuals within their home at our home care and hospice unit. For a vaccine update, as of the 1st of May, Northern Light Health has administered a total of 213,419 doses of vaccine at our vaccination clinics. This represents 118,934 first doses and 94,485 second doses. In addition, home care and hospice has administered 24,165 vaccine doses, and Northern Light Medical Transport has administered 473 doses. Northern Light Health is committed to continuing the vaccination efforts until every person who wants a vaccine gets one. As the pandemic evolves, our approach to vaccination changes to meet the needs of our communities. We are now offering walk-in vaccinations at all of our vaccine sites, providing first dose vaccinations. While we still recommend signing up for an appointment online or by phone in order to make the experience at the vaccination site as quick and easy as possible, the walk-in option may be convenient for those who haven't had an opportunity to yet get vaccinated. More than half of Maine's eligible population has been vaccinated to date. We are now beginning to shift away from large centralized vaccination sites. We're still going to be providing vaccine for the foreseeable future, but they will be offered in smaller locations. We are working hard to ensure that the smaller vaccination sites are just as fast and convenient to access. The timing for transition to the smaller clinics will be different in each community. Please look for more information about our plans for our clinics as the week goes on. And I'm going to turn over to Matt for some more details.
Great, thank you. I'm Matt Marston. I'm the Associate Vice President in Northern Light Pharmacy and the Operations Lead for the Northern Light Health vaccination effort. So I'm excited to share some news with all of you here today. We have some specific information to share about our approach to vaccination in the Bangor area. Our last first dose clinic at Cross Insurance Center will take place on May 6th. The Cross Center will remain the location for those who received their first dose at that location, but require their second doses. We anticipate winding down our Cross Center vaccine site after the second dose of clinic occurs on May 27th. Starting Tuesday, May 11th, 1 week from today, we'll begin offering first dose vaccines at the Northern Light Health Center on 885 Union Street in Bangor. The new vaccination site will be easy to access and efficient, just like our Cross Insurance Center site has been, and there will be plenty of signage to direct people to the vaccination area. We'll also be offering walk-in appointments, and as Dr. Jarvis mentioned, registering online beforehand will save time through the process. This clinic will be open Monday through Friday between 10:30 a.m. and 5:30 p.m. and Saturday from 8:30 a.m. to 4:30 p.m. For a period of time, we'll operate the clinics at both the Cross Insurance Center and on Union Street. It will provide clear communication on site when people receive a first dose about the location of their second dose, so there'll be no confusion about where to go for the second dose. So with that, I'll pass it back to Dr. Jarvis for some additional information.
Thank you, Matt. Maine has been a national leader in vaccination rates. Our healthcare providers, state and local governments, and every individual in Maine should be proud of that. While we celebrate this accomplishment, we continue to focus on making sure that those who have not yet been vaccinated have the information they need to make informed decisions. For example, this Thursday, our Good Health is Good Business series will focus on reasons to get the vaccine, how the vaccine works, how well it works, and the data behind vaccination. Experts from the University of Maine, Husson University, and Northern Light Health will be on hand to provide information and answer questions. We will stream this session live on Northern Light Health Facebook page. Learn more about this session and our other Good Health is Good Business programs at northernlighthealth.org. Additionally, 2 Northern Light Health physicians will be participating in an Ask Maine Doctor Zoom session on May 11th. This is another opportunity for the community to get credible and up-to-date information about vaccines. And lastly, I just want to say thank you and congratulations to everybody who has participated in our large-scale vaccination clinics across the state. It has been a monumental effort. It has been a pleasure to lead that organization and to see the success that we've had. We still have a long way to go, and with that, I'll take questions.
Okay, thank you very much, Matt and Dr. Jarvis. We're going to start with Mary Kate Mannion from WNTW. Mary Kate, when you are unmuted, please ask your questions.
Hi, thank you so much for taking my question, and good afternoon. Of course, things changing as this pandemic continues, and the FDA expecting and anticipated to approve expanding the use for the Pfizer vaccine to teens that are 12 to 15 years of age. Has that meant any changes or preps and planning from Northern Light Health's perspective?
So Mary Kate, that's a great question about what we've been doing in anticipation of emergency use authorization being extended for the Pfizer vaccine to those who are 12 and older. And so we've been planning for that actually since the beginning because we knew that this was coming. But over the last few weeks, we've been knowing that this was imminent. We have been planning a little bit more. So one of the efforts that we've been talking about as we gear down our large mass vaccination sites and move towards smaller things was how we can handle that. So Northern Light Health is proud to be able to say that we will be, we anticipate that shortly we will be providing vaccination within our provider sites. That'll be a slow rollout, and so we do ask for patience and time there. We will still be able to provide Pfizer vaccine during the roll down of our other large-scale facilities. In addition, we'll be reaching out through our home care and hospice agency, our work health program, and other entities in order to reach those communities as we need be. As we've said before, we are committed to stay open and vaccinate as long as there are Mainers who still want to be vaccinated, and we will continue to do that. We are delighted by this news that, that very shortly we'll be able to vaccinate even more Mainers, particularly those over the age of 12.
May I ask a follow-up question?
Absolutely.
Sure, if I can. What would be your message to Maine parents with this news coming who perhaps are a bit apprehensive about vaccinating their younger teens? Thank you.
I will just remind people that these vaccines are safe and efficient. We have been using the Pfizer vaccine the longest. We have some of the better data on that one for what its side effects are and what any long-term complications are. Thankfully, long-term complications, we have seen none. And side effects for the most people have been mild. And if they are severe, they typically only last a day or so. So again, very, very safe, very, very effective. What my plea is think about what this last year has been like for most of our students. They have been on either some kind of hybrid of being remote and going to school in person or having to stay home for long stretches of time due to outbreaks in schools and communities. We want to avoid that. The single best way that can happen is through vaccination, and the more people we get vaccinated, the better off we will be and the less we will see these outbreaks that hinder our children's experience and growth. By vaccinating your children, you are not only protecting them, you are protecting those that are around them, including yourself and your families. It is important that we continue this effort, and the more we get vaccinated now before summer months come, the better off we will be as fall season starts again for school years. So that's our plea. That's why we think that this is effective, and we have plenty of data to support that these vaccines are safe and will continue to work in limiting the effects of this pandemic. So thank you for that question.
Thank you, Mary Kate. Next up, we have Leslie Landrigan from Penobscot Bay Press.
Hi, Dr. Jarvis. I think you may have answered this question. Are you planning on administering the vaccine at your facilities in Castine and Stonington?
So I'll actually turn that over to Matt, who has a little bit more data on the actual clinics that we'll be able to start doing that at.
Sure, absolutely, and thanks for the question. As Dr. Jarvis had mentioned previously, we are actively engaging in plans to provide COVID vaccinations out of our physician practices. So the clinics that you had mentioned before, we are actively engaging in those planning efforts, and we're going to be excited in the near future to share some information about when to anticipate the availability of vaccine at those sites. So thank you for that.
And if you have a follow-up, Leslie?
Well, are you still going to be vaccinating people at the Family Dollar site in Ellsworth and at the Blue Hill Hospital?
So at this time, we are still providing vaccines at the shopping center in Ellsworth. and we do not have a transition date determined at this point in time for that. We're monitoring demand at that location, and we'll adjust as we're planning with our other sites when the time is right to do so. So at this time, we are continuing that vaccination clinic in Ellsworth. For Blue Hill, I know they're actively engaging in planning to try to provide COVID vaccines out of physician practices, understanding that there's not a mass vaccination site in Blue Hill. Part of their planning effort does include physician practices there.
And I will remind Chris, I was just going to remind everyone that if you go to northernlighthealth.org, you can find the locations of all of our vaccination sites, and there are still the ability to sign up online. And so that's an easy way to find out where we can continue to do first doses of whether that be Pfizer, Moderna, or Johnson & Johnson.
Good point. Thank you, Dr. Jarvis. Thank you, Matt. And thank you, Leslie. We're going to go now to WABI. Connor Clement, you're up.
Hey, good afternoon, everyone. Dr. Jarvis, question for you. You mentioned Northern Light Health gladly will continue to vaccinate all Mainers who want to be vaccinated. But what about the folks who are hesitant to get the vaccine still? What's your message to those people? And how do you guys plan to deal with vaccine hesitancy moving forward?
So we've been dealing with vaccine hesitancy all along. Obviously, initially when we started offering vaccines in January, we knew that there were going to be some early adopters who were really, wanted to get the vaccine. But we've seen every time that we've lowered the eligibility age in the state of Maine, we've always seen a very quick uptake and then a very quick downturn for the number of people who want to be vaccinated. It is phenomenal that we've already vaccinated about approximately 50% of Mainers who are eligible. That is tops in the nation, and we should all be proud of that. But that still means there's another 50% who right now, for whatever reason, have not been vaccinated. What I say to those people is you need to reach out to a reliable, informed source. For many people, that's going to be their primary care provider. It may also be a health system. It may be a trusted member in the community. But whoever it is, make sure that they know the science and the facts so that they can inform you so that you can make the best informed decision. What I can tell you is that these vaccines are safe, they are effective. We know that vaccination is the way for us to get through this pandemic. And so that's what we talk about. But there may be some other reasons why somebody may be concerned or have frank fear about the vaccine. And that's when you may need to have that one-on-one conversation. As we speak, Northern Light Health is providing information to our providers so that they can talk about, particularly when there are questions that are a little bit off of just normal fears and concerns about any kind of medication, so we can specifically address those. As we hear more questions come in, we will provide more answers. But right now, the single best thing for people to remember is there are plenty of reliable, informed sources out there that can give you the facts, the straight facts, so that you can make that informed decision.
All right, thanks for taking my question.
Absolutely.
Okay, thank you, Connor. Next, we're going to move to TV7, and that would be TJ Tremble, I believe. TJ, just let me find you. There you are.
Good afternoon. Dr.
Hey,
Jarvis, how are you?
I'm good, TJ. How are you?
Not too bad at all. Two quick questions. One, several months ago, you referred to the fact that you believe a booster shot probably will be necessary for the COVID vaccine. Do you, based on more data, has anything changed your mind on that?
Not really, TJ. I still am in the camp that we will need to have boosters. And in fact, probably even more so than I was a few months ago when I discussed that, simply because we're seeing this particular coronavirus that causes COVID-19 mutate and have variants faster than we've seen typically for coronaviruses in general. And because of that, we know we're going to have to catch up. You've heard the governor speak and others speak that we were a race between vaccination and variances. Well, those variants now are beginning to win that prize over because our vaccination rates have been slow. Again, even though it's tremendous and we need to credit a lot of individuals that 50% of eligible Mainers have been vaccinated, that still is a large percentage of the population that has not, and that allows for these variants to occur even more frequently, and therefore I think that those boosters are going to be necessary. It also follows the normal biology curves that we see for coronaviruses, which typically spike in the fall, continue to have disease over the winter, and then subside in spring and summer months. That's actually what we saw with this particular strain of the virus during the pandemic. And so we know that that's the typical thing that happens. We also know that lifelong immunity to coronaviruses is rare when we talk about human beings. So yes, I do think we're going to need to have boosters. What those boosters mean and when they're going to come still remains to be seen, but it looks like that's what we're talking about. Very similar to seasonal influenza vaccination.
And finally, sir, you going back to the vaccine hesitancy, in the past several months, what's the most common question you've gotten from people who are hesitant to get vaccinated?
That's an excellent question. I'd say that the most common question we hear is that these are new and we don't really know the science behind them or the data that they're safe. And what I say to that is, actually, there are now hundreds of millions of individuals who have been vaccinated with the predominant two vaccines, the Pfizer and the Moderna vaccine. But right behind that is Johnson & Johnson, which is rapidly gaining ground on the other two. So there are more than enough individuals who have had the vaccine and have had no severe consequences from the vaccine. We do know that there was some concern, particularly around Johnson & Johnson with the clotting disorder. But again, that seems to be more temporally related than causally related. And what I mean by that is that the timing of the clot occurred after the vaccine, but it's still not proven that the vaccine caused that. And in fact, it was such a rare occurrence that the natural course of that particular kind of clot is about the same as what they saw in those individuals who had been vaccinated. So I want to say that even though there was that concern about Johnson & Johnson, Johnson & Johnson is still safe and effective measure for us to help prevent this disease. But Pfizer and Moderna have not been shown to be involved in those, implicated at all in those clotting issues. And so if that's a fear for you, choose one of the other vaccines. Right now, the Pfizer and Moderna vaccines are readily available for people to get. So the biggest concern I've gotten is that they're new and their safety has not been proven. However, neither of those is true. While the technology has actually been around for a while to create these vaccines, the technology used for the Johnson & Johnson vaccine is one that's been used before. And so they are not new technologies. Yes, they're new vaccines, but just like any other new drug that's come onto the market, we know that they've been tested. And now we have many, many individuals, including those of us here who have been working at the Cross Insurance Center and across the state of Maine to protect you. Healthcare workers have stood up very early on to receive those vaccines, and we trust them. We trust the science. We know that they are safe, and not only that, we know that they protect ourselves, our patients, our families, and our communities. And that's really the thought that everybody needs to say. Who is it that you need to protect from this devastating disease? And if there's just one person out there that you need to protect, you should get vaccinated.
Yeah, to follow up on that too, one question that I receive frequently is the uncertainty regarding long-term effects of vaccines that are new to market. And what I will say is that we have not seen a significant number of long-term side effects for any of the vaccines that we've seen out there currently. And with this too, one thing that we know for certain now is that we're seeing some long-term effects of COVID illness. And so known long-term effects of coronavirus and COVID-19 are a factor in everyday life that we need to consider in terms of risk. And so the fear of the unknown with the vaccine weighed against the known risk of contracting coronavirus and the long-term effects that may result as of it. I think people need to weigh those options in their minds right now too. And for me, I very much feel like the vaccine is the best tool at our disposal at this moment to prevent those short-term and long-term effects of COVID-19 that we know exist and that we've been dealing with over the course of the pandemic.
Thank you, Matt. Thank you, Dr. Jarvis. Thank you, TJ. Next up, we've got Amy Brown from WERU.
Thank you. Dr. Jarvis, do you know the total number of people who have been hospitalized with COVID at Northern Light facilities total throughout the pandemic?
I do not have that information readily available, but we could get that information and share it with you after the briefing.
Okay, and then you may not know the answer to this either, but do you maybe even ballpark have a sense of how many people, if any, may have been admitted due to side effects from the vaccine?
I am not aware of anyone who was admitted due to side effects from the vaccine. I could be mistaken about that, but I have not heard of that. In fact, if we look across Northern Light Health's mass vaccination sites, we have had very few instances where we needed to do any intervention like call 911 services at all. It's remarkable, in fact, that has been the occurrence, because certainly other events could occur. If you just think about here at the Cross Insurance Center, where we're very close to having administered over 100,000 vaccinations, that's a lot of people through a single place that you'd expect just an emergency to occur naturally. And in fact, that has not happened either. And so again, very, very uncommon for any severe reaction to these vaccines. All of our sites, and when we start looking at transitioning to smaller facilities to be able to continue to administer vaccines, we will make sure that there are people that can readily respond to those emergencies if need be. But thankfully, they have been few and far between.
Okay, thank you very much for your questions, Amy. Next up is Bob Evans from News Center, Maine.
Good afternoon, gentlemen. I just have one question today. We now know your plan at the Cross Center in Bangor, but how are the numbers in Portland at the other Cross Arena, and how much longer do you think you will be there?
So to be clear, we're at the Expo in Portland as well as the main mall, not at the Cross Arena, but it's just for clarification. So the numbers at the main mall have been steadily dropping. We will continue that facility for a short period of time to finish out second doses, and if need be, with the drop in the age restriction for Pfizer, we will maintain that facility for that purpose if need be. As far as the Expo goes, again, numbers are falling, but not as fast as they have fallen in some of our other locations, and that's expected because we know that the Portland market needed more vaccination and more vaccination sites very early on, and we're still playing a little bit of catch up in that particular area. Again, we will be very clear as we draw down any one of our sites as to what the proposal will be to move the ability to vaccinate in other areas in those same communities. We will continue to follow what's happening in communities, and again, it's really a supply-demand issue. So very early on, we had a high demand and a very low supply. Now we have a pretty steady supply. We need that demand to continue and to continue to get more people who are eligible for vaccine vaccinated.
Absolutely. We'll continue.
Thank you, Bob. Are you all? Oh, go ahead.
I was just going to say thank you for the clarification.
Absolutely, and I just wanted to add that we monitor on a week-per-week basis all of the vaccine appointments that fill and the demand that's out there, and we really put a strong effort in to make sure that we have vaccine available where it's needed and where it's wanted, and in venues that will support the vaccinations. So we continue to evaluate that and make modifications, and we'll continue to communicate those changes as they come out. But our primary focus is supporting getting vaccines into arms of the people in Maine and our communities.
Okay, thank you, Bob. And last but not least, we have David Marino from Bangor Daily News.
Thank you so much. Dr. Jarvis, I wanted to ask you, a couple of different people have asked you about this, so I'm going to kind of rephrase my question a little bit. You mentioned that mass vaccination clinics have somewhat run their course. The kind of people who wanted to get the vaccine quickly or anxious to get it have primarily received it. For the other groups, what is it about a doctor's office that would make people in that group more likely to want to get vaccinated? Those who wouldn't want to get it at a mass clinic. Is there any studies that you're going off of for this that makes people more comfortable with the doctor's office? What is the rationale?
So David, that's a great question about why we feel some people would be more comfortable to get it in a doctor's office rather than at a site like this. I don't think we have any data to show one way or the other. I will say that as a practicing clinician and one who's practiced for a quarter of a century, I can't believe I'm saying that, there's a special bond between people and their primary care providers. They're a trusting voice, a trusting source of information, and sometimes that's what it takes, is just to have somebody that you're familiar with. While you guys have been gracious enough to let me come into people's homes to inform the public, I'm just another face on television. It's a big difference than when I'm in my office seeing my patients who I know and have cared for their families for many years now. It's a special bond, a special relationship, and certainly an easier way to transfer information in those one-on-one questions. It's also the way that most of us have received vaccines in the past. It's the way almost all children receive their childhood vaccinations. Adult vaccinations are often the same way. And even when we talk about seasonal influenza, still the majority of people are getting their influenza vaccination by somebody that they have some kind of relationship with, whether that be their primary care office, the hospital setting, or some kind of agency like our home care and hospice at Northern Light Health. We do know that retail pharmacies have played an important role in that, and we continue to see them play an important role in COVID-19 vaccination as well. And I think sometimes it's a matter of convenience. For some people, it was scary to come to a large facility, particularly one as large as the Cross Insurance Center, where at one point we vaccinated 3,000 people in a single day, which is almost as much as what we see, when we have basketball games here. And so there were people that were nervous about that, and we understand that. And that's the reason why, as the technology has improved and we've been able to make it so that we can deliver these vaccines in a place outside of a large-scale clinic, we are making that opportunity. So again, we can vaccinate every Mainer that wants to get vaccinated who is eligible to be vaccinated.
Yeah, there's definitely some patients out there that may prefer a setting that's more slow-paced, where they can come through and get questions answered and talk to their provider, as Dr. Jarvis mentioned, get some questions that remain unanswered to them answered, and make some informed decisions about getting vaccinated. In a mass vaccination center like Cross Insurance Center, it's incredibly efficient, and it's a smooth process from start to finish, which has been excellent. But that efficiency and speed in getting through the clinic may not be what some people are looking for. So having those discussions with their provider, I think, will offer a venue for people to get those questions answered, which is important.
Thank you both for answering that. There's been a lot of talk about the spectrum of vaccine hesitancy, those who will get the shot if it's convenient. And then there is a group, it seems, who will just get it under no circumstances. I'm sure that you both have met some people, maybe even some people in your life. I know that I have, who just will not get it under any circumstances. They might believe in some very untrue information about the vaccine, conspiracy theories. Is there a certain group who will never get vaccinated? Is there any, is it worth expelling the resources to try to get them to get vaccinated? And what does all of this mean for herd immunity efforts?
So that's a great question, David. And so from my standpoint, every life saved is a life worth trying to save. And so, yes, expending the resources to try to educate more is a valuable thing for us. We know that there are going to be people who either can't receive a vaccine for medical conditions or won't receive a vaccine for whatever their own personal choice might be. And that's the reason why we talk about community immunity, that we're talking about, numbers of about 80% of the eligible population being vaccinated, because we have to protect those that are either ineligible for vaccines, like children in this case, or those with medical conditions that prevent them from being vaccinated, or those who just won't be vaccinated. It's, again, one of those reasons why I say, ask yourself these questions when you're thinking about getting vaccinated, is who am I trying to protect? If it's just yourself, that's wonderful, go right ahead. But if there's other people in your sphere of influence that you interact with on a regular basis, you're protecting them as well. And that includes those people who under no circumstances are going to be vaccinated for whatever their personal choice is. And we respect those personal choices in medicine. We do hope that most people will eventually get vaccinated, because that only helps all of us. And at some point, I want to see this Cross Insurance Center used not for things like mass vaccination clinic or alternative care sites. I want to see basketball games here again. I want to see concerts here again. I want to see us outside congregating the way we used to. And the best way for us to do that is to have as many people who are eligible get vaccinated, and get vaccinated as quickly as possible. We've been talking about this since December, and we'll continue to talk about it until every Mainer who wants to be vaccinated gets vaccinated. So thank you, David, for letting us say that. And I think that might be our last comment for the day.
Thank you. Yes, Dr. Jarvis, Matt, thank you very much for your time. Members of the media, I want you all to notice I posted a Dropbox link in the chat window. There are some photographs and some video B-roll of folks getting vaccines at various clinics across the state. Our internal marketing communications team put that together for your use. So if you want to click or if you want to grab that link before you head out, you can access that if you would need it, if it makes it easier for you to do so. I know there was a few of you that had questions we weren't able to answer. We'll follow up with you after the press briefing if we're able to get you those answers. And I thank you all for your participation. Dr. Jarvis and Matt, are you all set? Do you have any last words?
All set. Thank you, everyone.
I think we're good.
Time.
Yeah, thank you all once again.